Hi, my name is Mary, and today I will be talking to you about aneurysms. So, what is an aneurysm? An aneurysm is an abnormal enlargement of part of an artery due to weakness in the wall of the blood vessel. This could either be a widening or a ballooning. Many aneurysms remain silent and eventually rupture, which can lead to a lot of serious health issues and even death. On the right here is a diagram of how an aneurysm progresses. It starts out with a blood vessel. In this case, this person has high blood pressure, which could weaken the wall of the artery. This could be due to the wall becoming less elastic. Then as blood goes through, it might build up, create blockage. The blood vessel will then dilate, and if it dilates too much, it could potentially burst and the aneurysm will rupture. The two most common locations for aneurysms are the aorta and the brain. However, they can happen anywhere in the body. They can happen behind the knee, the intestine, or the spleen. There's no clear cause of aneurysms, but they could be congenital. There could be a defect in the arterial wall. We do know that people with high blood pressure, high cholesterol, and smokers are at more of a risk for developing aneurysms. And pregnancy has also been linked to aneurysms in the spleen. So, who do aneurysms affect? Well, they affect 2 to 6% of America's population. If you're a male and you're age 65 or older, you are at a much higher risk for developing aneurysms. Family history also plays a very important role in aneurysms. There's an increased incidence in people with family history of them. And in these cases, aneurysms often come back in multiples. So you might have more than one, they might be larger, and they have the tendency to rupture earlier in life. So that would be before the age of 65. So there's two different types of aneurysms. There's fusiform and saccular. So here on the left, you'll see the fusiform aneurysm, and this is the widening shape that I mentioned earlier. It forms all the way around the artery. And then on the right, there's the saccular aneurysm, and this is more of the ballooning shape that I mentioned. And this is when the aneurysm protrudes from one side of the artery, and saccular aneurysms actually account for most ruptured aneurysms. So signs and symptoms. Oftentimes, aneurysms go unnoticed. You don't notice many signs and symptoms until you start having complications from the aneurysm. Then you'll start noticing signs and symptoms from other issues, other health issues. But sometimes there still might be some signs and symptoms from the aneurysm if it's closer to the body surface. That would be pain, swelling, a throbbing lump might develop. But when it's deeper in the body or even in the brain, that's when you really don't often see signs. However, there could be some in the brain due to expansion of the aneurysm that may press on nerves, and that could lead to double vision, dizziness, headaches, or ringing in the ear. Then, when an aneurysm ruptures, that's when you do notice a lot of signs and symptoms. You're going to be in a lot of pain, low blood pressure, tachycardia, lightheadedness, and you have a very high risk of death. Aneurysms may also lead to internal bleeding, stroke, aortic dissection, and angina. An aortic dissection is when there is a tear in the artery that's due to blood pushing up against a tear in the arterial wall. And this is because of the expansion of the aneurysm. So treatment and medication, there's a few different procedures that you can get done, but again, aneurysms, they're all different. It depends on the location, it depends on the size and how rapidly they're developing. So it's really important to get screenings done in order to detect these aneurysms since there are no signs and symptoms. And then after those screenings, if an aneurysm is found, the doctor will determine how at risk you are of the aneurysm rupturing, and they'll go from there on what to do about treating this aneurysm. So some people may just have to go get frequent checkups to check on how it's enlarging, how if it's getting any smaller, how it's developing, so and so. Others might need more serious treatment, which would be surgical procedures. So there's the first very common procedure that people often have done is clipping, and this is specifically for saccular aneurysms. And this is when a tiny metal clip, as you can see over here on the left, this tiny metal clip is placed on the neck of the aneurysm that connects it to the artery. And this cuts off blood flow to the aneurysm so that it stops it from enlarging. There's also endovascular coiling, also known as endovascular embolization. In this procedure, a catheter is inserted into the body and it locates the targeted artery. It then deploys a wire coil into the aneurysm, and this disrupts blood flow. So this, it causes blood to clot. It causes blood to clot, and then it also, as clipping does, it decreases enlargement or prevents enlargement in the aneurysm and hopefully will decrease its size. The last most common procedure, and also one of the more serious procedures, is vascular grafting, and that is here on the right-hand side next to the clipping picture. So in this case, you have a fusiform aneurysm that's pretty wide, and a catheter is inserted into this aneurysm, and then it deploys a stent graft, which is this large grayish white material that you see. This stent graft acts as a stable channel for blood to flow through the aneurysm rather than getting caught up in the aneurysm, causing it to enlarge anymore. But again, not all aneurysms require these surgical procedures. Some may just require prescription medication. That would be blood thinners or antihypertensives. An example of a blood thinner would be clopidogrel, and antihypertensive would be nimodipine. So when it comes to aneurysms and exercise, again, it all depends on the location and the size. It's really important that you monitor the intensity, because anything that's at too high of an intensity could cause the aneurysm to rupture. So the American College of Sports Medicine recommends exercise 3 days per week for 15 to 20 minutes at moderate to low intensity. And the larger the diameter of the aneurysm, you really want to make sure that you're decreasing the exercise intensity, because again, you don't want to trigger the aneurysm to rupture by having them work out at high intensity. You should also choose activities that are comfortable for the client and well tolerated, something they could do at their own pace and stop themselves if they're getting too stressed or feel like they're working too hard. So that could be walking, swimming, biking. Yoga has also been found to be a really good exercise for people with aneurysms because, again, they can practice it at a low intensity and it's good for controlling blood pressure. So now we're on to our case study. We have a male. He is 68 years old. He is 6 feet, 190 pounds. 2 years ago, he had vascular grafting surgery in order to maintain an aortic abdominal aneurysm, but he recently has been frequently complaining of chest pain. His father died of an aortic dissection caused by an aneurysm at age 80. He quit smoking 2 years ago after learning of his aneurysm. His blood pressure is 150 over 90 millimeters of mercury. His low-density lipoprotein levels are 128 milligrams per deciliter. His high-density lipoprotein levels are 49 milligrams per deciliter, and he is sedentary. So with risk stratification, he's a male, he's 68 years old, so that automatically puts him at moderate risk because of his age. He's 6 feet, 190 pounds, he's not obese or anything, so it's not a risk. He has an aortic abdominal aneurysm. That itself is not a risk, but because he's frequently complaining of chest pain, that is a risk because it's symptomatic of cardiovascular disease. His family history does not count as a risk. He quit smoking 2 years ago, so that's no longer a risk. His blood pressure, however, is 150 over 90, so that puts him at stage 1 hypertension, so that's a risk. His LDL levels and HDL levels are fine, they're not risks, but he is sedentary, so that's a risk. So in conclusion, with his age and his 3 other risks, he is at high risk because he's symptomatic of CVD. So anything we do with him, we want to make sure we get physician's clearance, and we want to make sure we have all of his medical history and all of his medical any background information that we'd need. His goals are to decrease his blood pressure and live a more active lifestyle because, again, we know that blood pressure is one of those factors that puts people at high risk of developing aneurysms. And if he lives a more active lifestyle, since he's been sedentary for so long, he's hoping that that will help lessen the stress of his aneurysm and decrease his chances of getting any more, especially since he does have family history of aortic abdominal aneurysms. So his chances of getting more are more likely. Special considerations, you really want to make sure that you're keeping the exercise intensity moderate to low. In this case, we're going to want to keep it lower since he is at very high risk. Avoid any heavy lifting because any heavy lifting could cause a sudden spike in blood pressure, which you definitely don't want when you're dealing with aneurysms. And you also want to remember to get that physician clearance before doing any testing and any exercise. So when it comes to exercise testing, ventricular aneurysms are relative contraindications to exercise, but they only become absolute contraindications when dissecting. So when someone has an aortic dissection, like I mentioned earlier. But there was a study done by the Annals Internal Medicine Journal, and they looked at 262 patients with aneurysms that were 4 centimeters or greater in diameter. Out of those 262 patients, only one had a ruptured aneurysm within 12 hours after completing the exercise test, which was a treadmill stress test. So because of there was only one out of 262, there were no other negative outcomes reported. They deemed exercise testing to be safe as long as it's at lower intensities. Um, so, but when it comes to exercise testing, again, it's really important to make sure that you're monitoring the intensity, you're monitoring their heart rate and their blood pressure because you really don't want to take any chances when it comes to aneurysms. So for this client, I would, remember to get physician approval before doing anything with them. We'll probably have to get a physical done. I'd have them exercising at low intensity for 20 minutes, 3 days per week. Because of their age, I want to do something that's less stress on their joints. So in his case, I would have him do swimming 2 days a week because it's really good for blood, improving blood circulation, not much stress on his joints. And also, since he's been sedentary for so long, I'd have him doing balance and strengthening exercises 1 day out of those 3 days. And that could be Tai Chi, that could be any balance movements on a Bosu ball. And I'd really want to encourage him to get at least 10 minutes of light activity in each day, just because he's been sedentary. He needs to try and get himself up and moving, but very low intensity. So it could be, something as simple as dusting around the house, putting dishes away, even going for a walk in the morning or after dinner. Anything, again, that gets him up and moving, but that he can do at a very, very low intensity and be comfortable with. So in conclusion, it's fine to exercise because, lowers your cholesterol, lowers your blood pressure, which we know are two factors that can put someone at very high risk of developing aneurysms. But it's very important that you keep the exercise intensity low to moderate, avoid any heavy lifting, no sudden spikes in blood pressure because those can really trigger the aneurysm to rupture or develop even larger. And you always want to be aware of the location and the size of the aneurysm in clients. And again, many aneurysms, they go unnoticed. So you might not see any signs or symptoms. So it's really important to get screening. And if your client has any inkling that something might be wrong, it's better to be safe than sorry because when aneurysms rupture, it's very hard to deal with the medical complications that come with it. And here is my bibliography. Thank you for listening, and I hope you enjoyed this presentation on aneurysms.